Thank you for tuning in to watch CAA's Invest New Jersey Leadership Summit. You're about to watch panel number 1, Smart Health, Stronger Communities, Building an Accessible Future for New Jersey Patients. Be sure to like and subscribe for more leadership content. Enjoy.
All right, every good event, every good game needs a good leadoff hitter. And so we're the leadoff hitter for today with our health panel. We're very excited to be here. Thank you to CAA, Invest New Jersey, to Abby and the entire staff for having us. It's been a great morning and will continue to be a great session. So from my perspective, a couple things before we get into intros. New Jersey healthcare and life sciences considered to be a powerhouse in this area. A powerhouse in patient care, a powerhouse in research, manufacturing, health, and innovation. And we hope to tap into a little bit of that today. As we know, healthcare practitioners are some of the most valued and trusted people that we rely on in society for their innovation in treatment, their innovation in providing care, and as well as helping manage costs and improve access to care. Healthcare is a key growth driver in the New Jersey marketplace, and the framework that we've built up over time is significant. And the region's leaders taking their role in continuing to progress the healthcare environment in New Jersey for all residents. Now, as mentioned by Abby, in this panel titled Smart Health, Stronger Communities, Building an Accessible Future for New Jersey's Patients, our panels discuss how efficient healthcare can help build stronger families and stronger communities. As Abby mentioned, my name is Bob Brasili. I'm the Chief Commercial Officer of Kedrion Biopharma. We are a local biopharma company based in Fort Lee, New Jersey, where our U.S. headquarters are, and we specialize in rare disease products all the way from discovery, manufacturing, to commercialization. And I look forward to meeting many of you during our breaks later on today. I would like to spend just a couple of minutes and ask the panel to introduce themselves. And I'm also going to put you guys on the spot. I'd like you also to introduce yourself and tell us what you do to stay healthy.
That may be the hardest question that I've had in a long time. I'm Carol Johnson. I am the president and CEO of University Hospital in Newark. We are the only state-supported acute care hospital, so we are the only public acute care hospital in the state. We are the acute care, trauma care provider for much of North Jersey. We are the helicopter emergency response for all of the state. We are EMS for Newark and 911 dispatch for Newark and many other communities in our surrounding area. We are the safety net. And so it is critically important to us that we are not only delivering on our immediate patient needs, but that equity in healthcare services across our state means that the people who we serve get the same level of care, the same kind of support as well all across the state. I have almost no answer to your other question, except that I try to go to sleep and earn at the same time, which I hear is like a thing you're supposed to do, so that's what I'll put on the list.
We'll take it. Very good, thank you. Good morning. My name is Dr. Ken Sable. I am the president for the Acute Care Hospital Division for Hackensack Meridian Health. For those who don't know, Hackensack Meridian Health is the largest, most comprehensive healthcare system in New Jersey, spanning many counties, mostly on the east side of the state. I've been with the network for 11 years. I am also a recovering emergency room physician, where I practiced in Brooklyn, New York for over a decade. Health is very important to me. I would say that I look at it into 3 buckets. 70% is diet, 20% is exercise, and 10% is sleep. Sleep is very important. Personally, gotten very into fitness over the past couple of years, and I love my boot camp class. I do it 3 days a week, and it kicks the crap out of me, and I keep going back for more. So, man, I feel great after it. So I encourage, keep moving. Good man. We got sleep, we got boot camp. So now you'll hit the third.
I wonder what's going to happen next. So, can't wait to hear what I say. So my name's Andy Murtha. I'm the dean of the Rutgers Robert Wood Johnson Medical School. I'm also the founding dean of what will be the new Rutgers School of Medicine. And for many of you may know that we are in the process of merging the two Rutgers medical schools, New Jersey Med School, Robert Wood Johnson Med School, into a single LCME accredited entity. It'll be one of the largest medical schools in the country. Right now it would be the second largest, and that may change over time. It'll be one of the largest medical schools in the country. An enormous amount of really terrific work has happened in both organizations over the last couple of years as we prepare for that work. My job is to train physicians for this healthcare workforce, and I am deeply committed to that. I'm an OBGYN by training, perhaps recovering OBGYN, maternal fetal medicine specialist. I trained and practiced at Duke, was there for 26 years, left and was the chair of OBGYN at University of California, San Francisco, before joining Rutgers in 2022. I have this ring. Does anybody know what this is? The Oura ring. That actually has been incredibly motivating to make sure I stay active throughout the day and that I end up watching for my sleep patterns. My sleep was not good last night, so I just want to prepare you for that. The filter comes off when that happens. And actually, I do have a personal trainer that I work with as well, so some strength training.
Fantastic. Thank you very much. You're wearing your Rutgers colors very proudly.
Yeah, that's
very nice. I did notice that. And you see why I say New Jersey is full of powerhouses in the healthcare. We have a very strong powerhouse panel. I'm going to start with a couple questions just in general for whoever might want to answer, and then we'll get into some specific questions. So, question for all. As patient data and AI-driven digital health tools expand, how can New Jersey enhance personalized, efficient care while protecting privacy and ensuring innovations reduce rather than widen gaps for rural, elderly, and low-income patients?
I'm happy to go first if that's second. But so thank you for the question, and thank you for being thoughtful about the need to ensure that these are products. The next round of innovation actually serves everyone and isn't sort of niche and fine for people who can afford it. I would say, because there's so many thought leaders and product developers and other leaders in the room, I mean, the key challenge is when you develop a product and you do user testing and you take it out to the market and you sell it to the commercial market, and then you come to us in the safety net and say, you should buy this too. Well, it hasn't been tested with our population. You haven't seen the real world applicability of it. You haven't seen the challenges that our patients face in their day-to-day lives, making those products usable for them. And so the earlier you engage with us, so that the individuals who lead complex lives but would benefit the most from some of this innovation are part of the front end, and actually also part of sharing in the community empowerment and resources that come from the development of these tools. I think that's better for all, and we'll start to help close some of those key gaps.
Great. I'll add to that. I think that the key themes for me are access and affordability. And I think from an access perspective, we are at the point where technology really has the opportunity to change the paradigm and move the needle. And when you think about rural and underserved communities, one of the number one things that they care about is access. What good is healthcare if you can't access it? And so, we know that over the next 10 years, as the baby boomer population maxes out in terms of age, we're going to have significant challenges meeting the supply and demand of clinicians, physicians, and providers with the demand from the communities. And the only way that we're going to be able to do that is to change our care delivery models, utilize technology to be able to make our system more efficient, keep people working at the top of their license, taking out some of the inefficiencies of how we operate today, so that we can really focus on access in terms of, today, tomorrow, this week. That's really where we want to get to. If you call up and you don't get an appointment for 6 months, how is that really helpful to you? And if you're in a rural community, it can be even longer. So again, today, tomorrow, this week, and how do we utilize technology to make the system more efficient to be able to work for the communities that we serve?
So I'll just add a couple of quick points. I think to sort of expand a little bit more on what Carol said, that when we think about engaging the diverse communities that make up New Jersey, it's important that we actually listen to what they believe that they need as well. So as we develop technologies, as we identify potential opportunities to better serve those communities, we have to actually engage in conversations to appreciate what it is that they think they need and how do we support their needs. It comes a lot from the mindset that we have been working hard to approach in our medical school, which is to listen to what the patient is telling us, to listen with an open heart and an open mind as we develop technologies, as we provide patient care. It's really critical for us to do that. On the physician side and the student side, it's also important for us to be thoughtful about how we adopt, thoughtful that some of the technology may not be perfect, and we could potentially be putting things at risk if we're not careful about how we use some of the new technologies that come out. So it's a tricky balance, and I was going to just say one or two little things. The Council of Deans, which is the American Association of Medical Colleges group of all of the 157 medical school deans across the country meets, we talk about AI all the time. And in academia, we typically don't adopt new things easily. We typically are skeptical and cynical, and we have to test it and study it and test it and study it until we're way behind where we should be. We can't do that with AI. We're not allowed to do that because it's already here and it's already being used. So we have to figure out how to adopt it in a meaningful way, in a respectful way, and in a way that's going to actually improve care for all. So.
In a responsible way too, which is what you hit on, which I think is very important. This industry, through all of our roles, relies on compliance, relies on privacy, and that will be protected, and AI can be utilized and keep that privacy in place. Great answers. Next question for the panel. What opportunities exist for public and private partnerships in building infrastructure needed for accessible, tech-enabled healthcare across New Jersey?
So I think public-private partnerships are absolutely essential to the future here, but I'm going to redefine the term a little bit. I think that partnerships are essential, but they can't be one-sided. And so, I was recently with another healthcare safety net leader who said, lots of AI developers are coming to our door because everyone knows that you need diverse patients and you need diverse inputs to actually produce an AI tool that's meaningful for the whole population. And so people are knocking on doors looking for how to access populations and inputs that would help make sure that these tools serve as many people as possible in the right way as possible. But this healthcare leader said to me, but no one should be giving their data over to them unless the community is part of the product development. Like, that's what a public-private partnership could look like going forward. Empower our communities by being at the table, being shared product developers, being part of the solution, so that at the end, you build community trust, you overcome the significant concerns and mistrust in the community about new technology, and 3, there's actual economic development that happens in the community as a consequence.
I completely agree, and I think it's about collaboration. We can't do it alone. Public can't do it alone. Private can't do it alone. There's so much to do. You have to, and the cost of doing things are so exorbitant. You have to find opportunities to collaborate between public and private partnerships. One great example, Hackensack Meridian Health and a public-private partnership building out a hub in Metro Park, which is I think it's the first in the country for a combined healthcare / transit hub. With the volume of people that come through, the jobs that are created, and the ability to, as you're in your transit going from DC to New York and stopping in New Jersey, to be able to get quick healthcare services, whether it's urgent care, imaging, longitudinal care, et cetera, as part of your daily routine. That's not been done before. So it's another example of how to take the best of the public and the best of the private, put them together to provide the best services for the community.
So I feel like at Rutgers and at Robert Johnson Med School and New Jersey Med School in Newark, we are at the hub of this, and excited to be able to bring our values to that public-private relationships. And for me, it actually goes back to relationships. It goes back to having conversations and deeply understanding, each other's perspectives, and we can actually find opportunities to move important work forward. I'll give you a quick example. For the last 3 years, since I've been at Rutgers, we've had our annual healthcare hackathon. It's actually a Rutgers Health event. We hold it in New Brunswick. We invite Google, AWS, Oracle, a number of other companies. They bring not just experts, but they bring software and hardware, and they bring all kinds of equipment. We have specific healthcare or medical education problems that we're struggling with. We have over 300 students from across the tri-state area, so many from the universities and colleges that you all are part of, come to spend a weekend with us. They start on Friday night and they don't leave until Sunday. They're up all night trying to solve a problem, partnering with these tech companies to help support the technology that's needed to advance that work. We've had several patents come from that work. We've had several important opportunities come out of that work. Those partnerships are essential, but it also takes time to understand what the problems are that we're trying to solve.
Fantastic. Yeah, the use of problem solving, data analytics, AI is tremendous, and the speed and efficiency with which it can help get closer to a solution is great. Carol, from a CEO seat, how do you evaluate return on investment of accessibility-focused technologies while balancing quality, workforce stability, and long-term financial health?
So to be really frank with you and pragmatic, we have to think about, we have limited resources. We have to start from the equation of what is best for our patients, but then we have to really query the question, we have to really push the question, because when we're assessing value for something, sometimes what we see is like, here's the product, would this be really useful? And then when you actually unpack it, like the long-term maintenance cost associated with it, the space that's necessary to do it, the fact that it is first generation and second generation might be online very quickly thereafter. What am I investing in now? Is it going to be obsolete relatively quickly? Do I need a lot of internal staff to be able to support it? All of those costs are part of the equation that go into what decisions we're able to make and not make. We want to be part of this technology revolution. We want to be part and lean in and make sure that the patients that we serve get the benefit of all that is coming. But, just to Dean Marshall's point earlier, how many people in this room have an Oura Ring or a smartwatch on right now? Okay. In my ED waiting room last night, no one would have raised their hand. So thinking about who are we trying to reach and what are we trying to get to them and how quickly can we do it? Because let's be clear, we still live in a world where we fax things to each other in healthcare. So we have a lot of work to do, but we want to be part of this revolution, and we want patients who live in historically underserved communities to be front and center as we build easier, more accessible, more affordable healthcare.
Great question. Great answer, Amin. Thank you. Thanks, Carol. For Amy, how should medical education evolve to prepare physicians for future where data literacy, virtual care, and team-based models are essential for clinical experience and expertise?
So thanks for the question. I think that the data literacy part of that question is actually kind of interesting because in many ways, healthcare has evolved so quickly over the last 20 plus years. It's impossible for any one of us to know everything. And in fact, actually, what's happening with the use of AI and other technologies is that our need to really understand the data is actually diminishing to a degree, provided we trust the sources that we're given. So from a data literacy perspective, we still need to be able to read the literature and question the data and those sorts of things, but the volume of data now in the appropriate hands, in the appropriate setting, can actually summarize things in a way that allow us to actually move our work forward in a more meaningful way. The cautionary tale of that is that we need to be careful because AI is not perfect. Sometimes there's hallucinations, and sometimes we depend on tools that actually will give us not the correct information. So there's a lot of concern about those things, and I think is really important for us to keep in mind as well.
I think you hit on it. Data literacy, AI, whatever tool you're using is a tool. It's designed to help you make a better decision, but not make a decision for you.
Yeah, and in many ways, I think that we have become so dependent on the computer in the clinical environment. We sit at the computer, that there is an opportunity with some of the technology that's coming for us to move away from that. And for us to not have our physicians actually finishing their notes at 10 o'clock at night and doing their charting. So there's an opportunity for us to really have a frame shift in how we actually care for our patients. We actually make eye contact and look at them, which I think it will be really powerful for community support.
Great answer. Ken, what are the biggest barriers to scaling digital health solutions consistently, and how can health systems use digital health tools to create a more seamless journey from emergency care to discharge to home recovery?
I think one of the biggest challenges with scaling anything is getting on some common definitions and platforms. We just heard the word fax, facsimile. I mean, we're still faxing in 2026 in healthcare. And when I asked a doctor's office, hey, could you email me that instead? We can't do that. It's not secure. How is a fax machine secure? You don't know who's on the other end of that getting a piece of paper.
The FDA still approves medicines through faxing.
Exactly.
Standing by the fax. Where's the fax machine?
So I think as an industry, we have to get better at like the banking industry. I mean, they were able to get all these banks to come together to create the Zelle platform, right? That many of us use. But in healthcare, it's still, we have disparate data systems. They don't talk to each other. We have one large, very large EHR company in Epic, which many hospital and health systems use today, which is great, but it's not, I would say, as interoperable as it probably should be. One of the, I think, biggest misses that we have is with the HITECH Act, we did not push for more interoperability. So we gave all this money for meaningful use and all these other technologies to develop further software and solutions, but they didn't talk to each other. And so, many of you go to a doctor who's not employed or a private doctor or affiliated with one hospital, they're on one platform. And you go to another place, they have a completely different system. Even if we're all on Epic, they have a different instance of Epic than I have. Now we try to get on Epic Everywhere and MyChart and Share, and it's gotten better, but we're still a long way, I think, from that. And at the end of the day, I think that there's a ton of solutions out there, but with AI, we're really just at the precipice of this whole industry. And we have to wait and see what's gonna survive. There's, every day I get called from 5 or 10 companies that we have a product to sell you and a service to sell you. How many of them are going to be here next year, in 2 years, in 5 years? And going down the road with proprietary products like that is very dangerous and costly. So I think it's keep our eyes open. Let's see what comes down the pike. Be cautious. We have to jump in with the technology. To Dr. Murtha's point, ambient listening, which is this concept. I mean, it's amazing. I wish I had this when I was an ER practicing doctor. You can basically go in the room, talk to the patient, and the AI is listening and writes your whole note for you. Whereas we used to her point, we used to go into the room, listen, take notes, and then go transcribe everything into a computer. So you took your highest priced assets, your physicians, and turned them into glorified data entry clerks. That wasn't good, and patients would see us just sitting at a computer. So I think getting back to good old-fashioned medicine, face-to-face contact with patients, listening to them, hearing them, I think that's going to be how we really leverage the technology going forward to improve the patient care.
That's great. That's super. We've got about 5 minutes left, so last question for the group. 5 years from now, what metrics should policymakers, providers, investors use to determine, if smart health is truly translated into stronger communities, stronger health, and stronger business here in New Jersey and beyond?
I'll start. So for this one, I would say, again, going back to access and affordability. So if we're not improving access and affordability, we have not done what we needed to do. And I think that, we always go back to the triple aim. It's high quality, great patient experience, lowest total cost of care. The other big thing I want to stress is, and I use this term, many of you may not have heard it, but it's health span. So many of us talk about lifespan. Lifespan is how long you live, which is great. We want to live long lives. But health span is the quality of life that you live. We can keep patients alive for years without any quality of life, right? We've done that. We have machines that can do that. But is that really what we're after? Or are we after, living your life long, but high quality and enjoyable?
I'll go. So I think about this a lot, actually, and for me, it was one of my motivators to come back to the Northeast. I grew up in Rockland, so not from Jersey, but pretty close. I've seen Bruce Springsteen 7 times, so I think that counts. So many people in New Jersey, when they have complex care needs, they cross a bridge for that care. They go into New York City or to Philadelphia for complex care delivery. And it's my opinion that we shouldn't actually have that be the case, that we should have everybody in New Jersey have the opportunity to have the highest level of care in your state. To me, that's the opportunity and that's the measure that we should be judged on over the next 5 years. And how AI and technology helps us do that is about actually how we are able to build complex care delivery systems across the state. That is what I hope to be accomplishing over the coming years, and to me that's really important, because when people have to cross a bridge for complex care, it's easy if you have means and capacity to do so, and if you do not, you struggle to get that care that you need. And that's the part that's not right, and we need to be able to provide that care for everybody in the state. So,
I think that the metric at a minimum that we should hold ourselves to in 5 years is lower acuity, which is really saying that people are less sick. And if we do that well, that means people are getting preventive services, they're getting it in their community, they're getting it early and accessible, they're getting home health after they get discharged so they're not rebounding to the hospital, they're getting the kind of community supports that we've all focused on when it comes to social determinants, meaning that there isn't as much food insecurity, there is easier access to housing. So if people are less sick, in 5 years, then the products and all the other things we are doing as partners in this community will mean that we have made measurable difference for people in New Jersey.
That's great. Just to wrap up a couple of things, I think we circled around cost of care, access to care, building healthy populations. And the panel has done a great job talking about how technology, digital innovation, and people can help us achieve those in better areas than we are achieving them today. From Kedrion Biopharma's perspective, we partner with our healthcare partners on the stage and across New Jersey to help do the same thing. We want to make sure that the patient journey for whatever therapy area, disease they're suffering from, is defined as quick, as efficient, and as appropriate as possible. And we look to play a part in that as well. I also believe that each one of us in this room, taking part in your own personal health and your family's personal health, is vital to building healthier communities. It's vital to building more vibrant communities, whether it's the diet, whether it's the exercise, the sleep, whatever it may be that fits into your agenda and that you can work with your colleagues and your family on. It helps us take control of our own health and the costs and the innovation that we can bring as well. So on behalf of CAA, on behalf of Invest New Jersey, I want to thank our panel. Please join me in thanking them for their answers, their contributions. And I'd like to turn it back over to Abby for the next group.